welcome to Are You Smarter Than a Fifth Grader? My name is Aliah Azimah and I'll be your host today. Today we invited two special guests to answer some questions regarding canine parvovirus. So without further ado, let's see how they do. Ladies and gentlemen, I present to you our special guest of the day. The first one, a housewife from Rutiana residence, and her name is Putri Sabreena. Please welcome. And next, our special guest that comes from a family of athletes representing Malaysia in the 2020 Olympics, Miss Celestine Ho. Ladies and gentlemen, are you ready?
Yes!
Alright. The first question is, what is the agent of canine parvovirus? Is it A, rotavirus, B, canine parvovirus type 2, C, adenovirus, or D, lysovirus? Yes, Miss Sabreena.
The answer is B.
Yes, the answer B is correct. It is indeed canine parvovirus type 2. Good job. The next question is, what is the characteristic of canine parvovirus? Is it A, non-enveloped DNA virus, B, an enveloped DNA, or C, an enveloped RNA, or D, an enveloped RNA? Yes, Miss Celestine Ho.
I know the answer is A, non-enveloped DNA.
That is correct! Well done, Miss Celestine Ho. The next question is, what is the susceptible age for canine parvovirus? Is it A, 6 months to 1 year, B, more than 1 year, C, less than 1 week, or D, 6 weeks to 6 months? Yes, Miss Putri Sabreena.
The answer is D, 6 weeks to 6 months.
Ladies and gentlemen, the answer is D, 6 weeks to 6 months. Very well done, Miss Sabreena. For the next question, which is not a predisposing factor for canine parvovirus? Is it A, no protective immunity, B, keeping pets of other species, C, intestinal parasites, or D, overcrowding and poor hygiene? Yes, Miss Ho.
The answer is B, keeping pets of other species.
The answer is yes, indeed, it's B, keeping other species. Now, would you care to explain why, Miss Celestine?
Because, if not mistaken, from what I know, canine parvovirus can only infect dogs, not other species.
That is indeed correct. Wonderful. For the next question, true or false? Canine parvovirus can only be transmitted via the fecal-oral route. Is it true or false? Yes, Miss Putri Sabreena.
It's false.
Yes, the answer is indeed false. So, what is your explanation for this?
Because based on what I read as well, canine parvovirus is transmitted via two common routes, which is the fecal-oral route and also the oral nasal.
Yes, that is indeed correct. It can also be transmitted via the oral nasal route. The next question is, canine parvovirus is known to infect organs with mitotically active cells. Which one of these organs have mitotically active cells? A, the thymus, B, the heart, C, intestines, or D, all of the above? Miss Celestine Ho, very well done.
D, all of the above.
Yes, the answer is all of the above indeed. Very well done. So, the next question. How long will the host be shedding the virus post-infection? A, 1 to 2 weeks, B, 2 to 3 weeks, C, 3 to 4 weeks, or D, 4 to 5 weeks? Yes, Miss Sabreena.
I think it's 3 to 4 weeks.
Let's see the correct answer, folks. Yes, indeed, it is 3 to 4 weeks. Well done. Okay, ladies and gentlemen, we have reached the end of our first half of questioning. Now we shall proceed with a commercial break before we continue with the second half. Thank you very much. Ladies and gentlemen, gentlemen, welcome back to Are You Smarter Than a 5th Grader? Welcome our contestants again, Miss Putri, Sabreena and Miss Celestine Hope. And for this second half, the questions are gonna be a little bit more difficult. And you will not be given any more multiple choice questions. So to help you in answering these questions, we have provided you with 2 choices, which is either to ask for a hint, whereby I will give you keywords that can help you to answer the questions, or you can call for help, whereby we will give you a chance to contact a family member or a relative who might know the answer to answer the question for you. Are you clear, contestants?
Yes.
Yes.
Alright, so let's begin with our questions. The first question is, what are the typical clinical manifestations shown in canine parvovirus? Yes, Miss Putri.
So the typical clinical manifestations shown in CPV are first vomiting, diarrhea, dehydration, abdominal pain, and as the disease progresses, the animal may have hypovolemic shock, which if left untreated can lead to death.
Very well done, Miss Putri Sabreena. That is indeed the correct answer. We move on to the second question. Explain to me the pathogenesis of canine parvovirus. Yes, Miss Putri.
Can I use a lifeline for this one?
Yes, indeed, you may.
Okay. I would like to call my father, who happens to be a vet.
Here you go, Miss Putri Sabreena. Go ahead.
Hey Dad, can I know the pathogenesis for canine parvovirus?
Okay, I'll briefly explain about it. So CPV type 2 can spread using 2 routes, which is the fecal-oral route and oral-nasal route. So this fecal exclusion of virus can be as early as 3 days after experimental inoculation. So this parvovirus can infect the germinal epithelium of the intestinal tract, causing epithelial destruction and villus collapse. As a result, the normal cell turnover is impaired, leading to the characteristic pathologic lesion of shortened and atrophic villi, which leads to small intestine will lose its absorptive capacity, leading to diarrhea and vomiting. Also, the extensive lymphocytolysis in the thymic cortex as compared with other lymphoid tissue further reflects the high mitotic rate found in this organ, and it's thus not surprising that infected puppies develop severe lymphopenia. Okay, that's all. Good luck, sweetie.
Okay, thank you. So there goes my answer.
That is indeed the correct answer. Well done, Miss Putri Sabreena and her father, the veterinarian. Now, the second question is, what are the typical clinical pathological features in canine parvoviral infections? Yes, Miss Hope.
I know. Okay, the typical CP features is lymphopenia, anemia, and hint please.
Alright, so the hints for you are inappetence, vomiting, and diarrhea.
Okay, inappetence will lead to hypoalbuminemia. Diarrhea vomiting will lead to hypokalemia, hypochloremia, and as well as hyponatremia. And then the dehydration part will lead to increase in urea, creatinine, as well as phosphate.
That is indeed correct. Well done, Miss Celestine Hope. Now let's continue with our next question. What is the gold standard diagnostic test for canine parvovirus? Yes, Miss Putri.
Okay. I believe that the gold standard for diagnosing CPV is the Parvovirus fecal antigen test kit. Yeah.
And the answer is correct! Well done, Miss Putri Sabreena. We move on to our next question. Can you give me some examples of supportive therapy for canine parvoviral infection? Yes, Miss Celestine.
Okay, some example of supportive therapy for CPV infections can be because the major problem is dehydration, so we need to give fluid therapy, as well as to balance back the electrolyte by giving maybe potassium chloride, as well as maybe give some antibiotics to prevent secondary bacterial infection. And if the dog has vomiting, then you can give anti-emetic drugs. I guess, yeah, that's all.
Yes, that is indeed correct. Thank you very much, Miss Celestine, for your very thorough explanation. The next question, ladies and gentlemen, what is the best preventive method of canine parvoviral infections? Yes, Putri?
I believe it's vaccination.
Very well done. That is the correct answer. Vaccination is indeed the best protection method for canine parvovirus. Well, ladies and gentlemen, we have reached the end of our show. Are you smarter than a 5th grader? So today we have seen our contestants battle it out for the most invigorating contest ever. Who might be the winner for this round? And the winner is Miss Putri Sabreena! Well done, Miss Putri. You have indeed shown that you are smarter than a 5th grader. We will see you again, ladies and gentlemen, in our second session of Are You Smarter Than a 5th Grader? Every Tuesday at 5 p.m. Thank you for joining.